Welcome to NCLEX Made Easy 91. Struggling with GI questions on the NCLEX? You're not alone. But guess what? The secret is sticking to the end because the last 10 video is frequent NCLEX questions on gastrointestinal.
These aren't just practice questions, they're real clinical thinking drills with strategies that help you pass.
Stick around, because every question builds your confidence, and the last ones, they're the NCLEX game changers. Hit like, grab your notes, and let's turn confusion into confidence. Starting now.
Question 21. A nurse is preparing to administer loperamide to a client with acute diarrhea. Which assessment is most important before giving this medication? A. Presence of nausea. B. Bowel sounds in all quadrants. C. Recent travel history. D. Frequency of urination. Correct answer. C. Recent travel history. Rationale. Loperamide is an antidiarrheal that slows gastrointestinal motility. If the diarrhea is due to an infectious cause, especially from travel, for example, traveler's diarrhea due to E. coli, then slowing peristalsis may retain toxins in the intestines and worsen the condition. Identifying travel history helps determine if a more targeted antibiotic approach is required rather than symptomatic treatment. Strategy. Focus on client safety and causative factors. Eliminate distractors that do not directly impact decision-making for this medication. Travel history relates to infectious origin, which contraindicates using antidiarrheals like loperamide. Question 22. A nurse is caring for a client with suspected appendicitis. Which intervention should the nurse question? A. Keeping the client NPO. B. Applying an ice pack to the abdomen. C. Administering a laxative. D. Initiating IV fluids. Correct answer. C. Administering a laxative. Rationale. Laxatives increase intestinal motility, which can lead to perforation in a client with suspected appendicitis. Appendicitis involves inflammation and potential rupture of the appendix. Stimulating the bowel can exacerbate the risk. Conservative, non-invasive management is preferred until diagnosis is confirmed. Strategy. Ask yourself which option could cause harm or worsen the condition. Options A, B, and D are supportive. Laxatives pose a serious risk of perforation. Thus, this option must be avoided. Question 23. A nurse is educating a client about dietary changes for gastroesophageal reflux disease, GERD. Which food should the client be advised to avoid? A. Oatmeal. B. Bananas. C. Chocolate. D. Rice. Correct answer. C. Chocolate. Rationale. Chocolate contains methylxanthines, which relax the lower esophageal sphincter, allowing stomach acid to reflux into the esophagus, worsening GERD symptoms. Strategy. Use knowledge of pathophysiology. GERD worsens with foods that weaken the LES. The other choices are bland or neutral foods. Look for trigger foods that exacerbate acid reflux. Question 24. The nurse is reviewing the chart of a client who is scheduled for colonoscopy. Which finding should prompt the nurse to notify the healthcare provider before the procedure? A. Hemoglobin level of 14 grams per deciliter. B. Client reports abdominal cramping from the bowel prep. C. Platelet count of 85,000 per cubic millimeters. D. Blood pressure of 118/76 millimeters of Morkidri. Correct answer. C. Platelet count of 85,000 per cubic millimeters. Rationale. A low platelet count increases the risk for bleeding during invasive procedures like colonoscopy, especially if biopsies are taken. The provider must be notified and the procedure may need to be delayed or special precautions taken. Strategy. Focus on abnormal values. All other data are either expected or acceptable. The platelet count is significantly low, under 150,000 per cubic millimeters, indicating risk. Question 25. A client is being discharged after hospitalization for acute gastritis. Which statement by the client indicates a need for further education? A. I will avoid alcohol. B. I will eat small, frequent meals. C. I can continue using ibuprofen for arthritis. D. I will stop smoking. Correct answer. C. I can continue using ibuprofen for arthritis. Rationale. NSAIDs like ibuprofen are known to irritate the gastric mucosa and are a common cause of gastritis. These should be avoided or replaced with safer alternatives, e.g., acetaminophen, under provider guidance. Strategy. Look for the unsafe behavior or incorrect assumption. Clients often misunderstand the risks of over-the-counter drugs. Flag anything that continues the cause of the problem, e.g., NSAID use in gastritis. Question 26. A nurse is reviewing a prescription for total parenteral nutrition, TPN, for a client with short bowel syndrome. What is the priority nursing action? A. Administer through a peripheral IV line. B. Monitor blood glucose every 6 hours. C. Add medications directly into the TPN bag. D. Administer without using a pump. Correct answer. B. Monitor blood glucose every 6 hours. Rationale. TPN is high in dextrose and can cause hyperglycemia, especially in acutely ill clients or those receiving corticosteroids. Blood glucose should be monitored regularly. TPN requires central venous access, should be delivered via pump, and medications should not be mixed unless approved by pharmacy. Strategy. When assessing options, focus on what can cause the most harm if missed. Monitoring glucose is essential to avoid undetected hyperglycemia, which can be dangerous. Use knowledge of pathophysiology. GERD worsens with foods that weaken the LES. The other choices are bland or neutral foods. Question 27. A client with esophageal varices is admitted with vomiting of bright red blood. What is the nurse's first action? A. Insert a nasogastric tube. B. Administer IV pantoprazole. C. Check vital signs. D. Position the client flat in bed. Correct answer. C. Check vital signs. Rationale. Esophageal varices can rupture and lead to massive hemorrhage. Assessing vital signs is essential to evaluate hemodynamic stability and guide emergency interventions, e.g., fluid resuscitation, blood products. Strategy. In emergencies, follow the ABCs: airway, breathing, circulation. In this case, circulation is the priority. Vital signs will help determine if the client is going into shock. Question 28. A client with chronic hepatitis B is concerned about infecting family members. Which teaching is most appropriate? A. Hepatitis B is spread only through food and water. B. There's no vaccine to protect others. C. Avoid sharing personal items like razors and toothbrushes. D. Use gloves at all times when around others. Correct answer. C. Avoid sharing personal items like razors and toothbrushes. Rationale. Hepatitis B is transmitted through blood and body fluids. Sharing items that can carry microscopic blood, e.g. razors, toothbrushes, increases transmission risk. A vaccine exists and is recommended for close contacts. Strategy. Choose the option with preventive behavior that directly relates to the transmission route. Eliminate answers that are incorrect or overgeneralized, e.g., use gloves at all times. Question 29. A client receiving cisplatin chemotherapy for colon cancer is experiencing nausea. The nurse should anticipate administration of which medication? A. Promethazine. B. Diphenhydramine. C. Ondansetron. D. Docusate sodium. Correct answer. C. Ondansetron. Rationale. Ondansetron is a serotonin receptor antagonist, effective in treating chemotherapy-induced nausea. It works by blocking serotonin in the GI tract and CNS, offering targeted relief. Strategy. Use pharmacologic class knowledge. Recognize that ondansetron is preferred for chemotherapy-related nausea due to its mechanism and effectiveness over first-generation antihistamines or sedatives. Question 30. A nurse is caring for a client with liver cirrhosis who develops confusion and asterixis. Which lab value is most important to review? A. Serum creatinine. B. Serum potassium. C. Serum ammonia. D. Serum calcium. Correct answer. C. Serum ammonia. Rationale. Elevated ammonia levels are neurotoxic and lead to hepatic encephalopathy, manifested by confusion and asterixis, flapping tremor. Managing ammonia levels, e.g. with lactulose, is key to treatment. Strategy: match clinical signs to the underlying pathology. Confusion and asterixis in a cirrhotic client point directly to hepatic encephalopathy, for which ammonia is the hallmark lab marker. Question 31. A client with Crohn's disease is receiving long-term corticosteroid therapy. Which potential complication should the nurse monitor for? A. Hyperkalemia. B. Hypoglycemia. C. Osteoporosis. D. Increased urinary output. Correct answer: C. Osteoporosis. Rationale: long-term corticosteroid use leads to bone demineralization, placing the client at risk for osteoporosis. Corticosteroids interfere with calcium absorption and promote bone resorption. This is particularly important in chronic inflammatory conditions like Crohn's disease, where prolonged therapy is common. Strategy: choose the complication most specific to long-term corticosteroid use. Eliminate acute symptoms, e.g. hypoglycemia, and focus on long-term safety issues like bone health. Question 32. A client with gastroenteritis reports diarrhea and dizziness. The nurse notes dry mucous membranes and poor skin turgor. What is the priority nursing action? A. Administer loperamide. B. Offer oral fluids. C. Initiate IV normal saline. D. Reassure the client and monitor. Correct answer: C. Initiate IV normal saline. Rationale: this client is exhibiting signs of moderate to severe dehydration, including dizziness and dry mucosa. IV fluids are essential for rapid volume replacement and prevention of hypovolemic shock. Oral rehydration may not be sufficient or tolerated at this stage. Strategy: apply the Maslow hierarchy and prioritize physiological needs first. Circulatory status is compromised, so immediate fluid resuscitation via IV is the best course. Question 33. A nurse is caring for a client with stomatitis due to chemotherapy. Which nursing intervention is most appropriate? A. Provide lemon glycerin swabs for mouth care. B. Encourage intake of citrus fruits. C. Offer cold, bland, non-acidic foods. D. Use alcohol-based mouthwash every 2 hours. Correct answer: C. Offer cold, bland, non-acidic foods. Rationale: stomatitis involves inflammation and ulceration of the oral mucosa, commonly seen in clients on chemotherapy. Cold, bland, non-irritating foods, e.g. applesauce, yogurt, gelatin, reduce discomfort and promote intake. Acidic or alcohol-based products worsen irritation. Strategy: eliminate answers that increase irritation. Choose the intervention that promotes comfort and healing of inflamed mucosa. Question 37. The nurse is providing discharge teaching to a client who had a hemorrhoidectomy. Which statement requires further education? A. I will use a stool softener daily. B. I can take sitz baths to relieve discomfort. C. I should avoid lifting heavy objects. D. I will avoid all physical activity for several weeks. Correct answer: D. I will avoid all physical activity for several weeks. Rationale: while strenuous activity should be avoided, light walking promotes circulation, reduces risk of constipation, and supports recovery. Complete inactivity increases risk for complications like thromboembolism and constipation. Strategy: eliminate extreme or overly restrictive behaviors. Select options that promote balanced recovery, not full inactivity. Question 38. A nurse is caring for a client with irritable bowel syndrome, IBS. Which diet modification should the nurse suggest to help manage symptoms? A. High-fat, low-fiber diet. B. Spicy food and carbonated beverages. C. Low FODMAP diet. D. High lactose, high protein diet. Correct answer C. Low FODMAP diet. Rationale: FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are short-chain carbohydrates that can exacerbate IBS symptoms. A low FODMAP diet reduces bloating, gas, and diarrhea in many clients. Strategy: select evidence-based interventions. Eliminate trendy, incorrect, or high irritant diets, e.g. spicy, fatty, carbonated foods. Question 39. A client with gastric ulcer is prescribed pantoprazole. What teaching point is essential regarding this medication? A. Take the medication with food. B. Do not crush or chew the tablet. C. Stop the medication if you feel better. D. Take an antacid at the same time. Correct answer B. Do not crush or chew the tablet. Rationale: pantoprazole is a delayed-release proton pump inhibitor. Crushing it destroys the enteric coating and inactivates the drug in stomach acid. It should be swallowed whole, ideally before meals. Strategy: understand formulation importance. Delayed or enteric-coated drugs must be intact to function properly. Focus on drug administration principles. Question 40. A nurse is caring for a client who is 6 hours post-op after a laparoscopic cholecystectomy. Which finding should the nurse report to the healthcare provider? A. Shoulder pain. B. Mild abdominal bloating. C. Temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. D. Complaints of thirst. Correct answer C. Temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. Rationale: a low-grade fever is expected initially post-op. However, a temperature exceeding 101 degrees Fahrenheit, 38.3 degrees Celsius, may signal infection or a developing complication, such as bile leakage or abscess formation. It requires immediate evaluation. Strategy: look for red flags in post-op monitoring. Vital sign changes, especially fever, tachycardia, often signal developing infections or complications. Question 41. A client with a history of peptic ulcer disease, PUD, is admitted with sudden severe abdominal pain and a rigid board-like abdomen. What is the nurse's priority action? A. Assess bowel sounds. B. Administer prescribed antacids. C. Notify the healthcare provider immediately. D. Place the client in high Fowler's position. Correct answer C. Notify the healthcare provider immediately. Rationale: a rigid, board-like abdomen and sudden pain are signs of perforation, a life-threatening complication of PUD. It indicates leakage of gastric contents into the peritoneal cavity, leading to peritonitis. This is a surgical emergency, and any delay can lead to septic shock or death. Strategy: recognize emergency warning signs. A rigid abdomen equals peritonitis. Eliminate interventions that delay life-saving action. Always act immediately on life-threatening GI symptoms. Question 42. The nurse is caring for a client with portal hypertension secondary to liver cirrhosis. Which intervention is most effective in preventing esophageal variceal bleeding? A. Encourage fluid restriction. B. Administer lactulose daily. C. Administer prescribed beta blockers. D. Elevate the head of the bed. Correct answer C. Administer prescribed beta blockers. Rationale: non-selective beta blockers, e.g. propranolol, nadolol, reduce portal pressure, thereby decreasing the risk of esophageal variceal rupture. Preventing increased portal circulation is the cornerstone of prophylaxis in cirrhotic clients at risk for GI bleeding. Strategy: focus on prevention, not just treatment. Understand drug actions in reducing portal hypertension. Beta blockers are standard. Eliminate options unrelated to pressure control. Question 43. A client with ulcerative colitis reports 12 loose, bloody stools per day, and abdominal cramping. What is the nurse's priority assessment? A. Serum potassium levels. B. Body temperature. C. White blood cell count. D. Frequency of bowel sounds. Correct answer. A. Serum potassium levels. Rationale. Excessive diarrhea leads to potassium loss, risking hypokalemia, which can result in cardiac dysrhythmias. Electrolyte monitoring is critical in clients with active inflammatory bowel disease. Potassium levels can drop quickly, especially with high-volume fluid loss. Strategy. Prioritize life-threatening imbalances. Electrolyte disturbances take precedence over lab indicators of infection, e.g. WBCs, unless sepsis is suspected. Question 44. The nurse is teaching a client about colon cancer screening. Which client statement indicates a need for further teaching? A. I will begin annual fecal occult blood testing at age 45. B. I should get a colonoscopy every 10 years after age 50. C. I will report any blood in my stool to my provider. D. If I have a family history, I may need screening earlier. Correct answer. B. I should get a colonoscopy every 10 years after age 50. Rationale. The updated guidelines recommend that average-risk adults begin colonoscopy screening at age 45, not 50. This answer reflects outdated information and needs correction. Earlier screening may be needed for high-risk individuals. Strategy. No current evidence-based guidelines. Watch for outdated practices or patient misunderstandings in teaching scenarios. Question 45. A client with pancreatitis has a nasogastric tube in place and reports increasing abdominal pain and nausea. What is the nurse's best action? A. Advance the NG tube. B. Check for NG tube patency. C. Increase oral intake. D. Administer morphine immediately. Correct answer. B. Check for NG tube patency. Rationale. In pancreatitis, an NG tube is used to decompress the stomach and prevent stimulation of pancreatic enzymes. If symptoms worsen, the NG tube may be blocked, leading to gastric distension. Ensuring patency addresses the root cause of discomfort. Strategy. Always assess before intervening. In post-op and GI patients, blocked tubing is a common reversible issue. Assess device function before escalating care. Question 46. A nurse is reviewing discharge instructions with a client recovering from hiatal hernia repair. Which statement by the client requires follow-up? A. I will avoid lying down right after eating. B. I will eat small, frequent meals. C. I will avoid carbonated beverages. D. I will wear a tight abdominal binder. Correct answer, D. I will wear a tight abdominal binder. Rationale, tight clothing or binders increase intra-abdominal pressure, which can worsen reflux and impair surgical healing. Clients should wear loose-fitting clothes and avoid anything that constricts the abdomen. Strategy, identify behaviors that contradict treatment goals. Here, decreasing pressure and promoting GI comfort. Look for statements that cause mechanical interference. Question 47. The nurse is caring for a client post-endoscopic retrograde cholangiopancreatography, ERCP. Which finding requires immediate intervention? A. Mild sore throat. B. Nausea. C. Diminished bowel sounds and abdominal rigidity. D. Sleepiness. Correct answer? C. Diminished bowel sounds and abdominal rigidity. Rationale? These are signs of perforation or pancreatitis, which are known complications of ERCP. The nurse should suspect peritonitis and notify the provider urgently. Mild sore throat and nausea are expected post-procedural effects. Strategy: always prioritize signs of organ damage or acute abdomen after procedures. Recognize that abdominal rigidity is never normal and is a red flag. Question 48. A client is receiving Lactulose for hepatic encephalopathy. Which finding best indicates the medication is effective? A. Increased serum albumin. B. Decreased ammonia level. C. Increased urine output. D. Normal liver enzyme levels. Correct answer. B. Decreased ammonia level. Rationale: the goal of lactulose in hepatic encephalopathy is to trap ammonia in the colon and facilitate its excretion. Effectiveness is measured by improved mental status and a decrease in serum ammonia levels. Strategy: know the therapeutic goal of the medication. Match outcome measures, labs or symptoms, directly to the purpose of the drug. Question 49. A nurse is planning care for a client with diverticulosis. Which of the following should be included in the client's plan of care? A. Encourage a high-fiber diet. B. Restrict fluids to reduce bloating. C. Administer daily laxatives. D. Provide a low-residue diet. Correct answer: A. Encourage a high-fiber diet. Rationale: in diverticulosis, not active inflammation, high-fiber foods help soften stool and promote regularity, which prevents constipation and further formation of diverticula. Adequate fluid intake must also be encouraged. A low-residue diet is used during diverticulitis, not diverticulosis. Strategy: differentiate between diverticulosis, chronic, asymptomatic, and diverticulitis, acute, inflamed. Treatment approaches differ. Use the disease phase to guide correct intervention. Question 50. A nurse is caring for a client with chronic constipation. Which non-pharmacological intervention should the nurse recommend to help promote regular bowel function? A. Restrict fluid intake before bedtime. B. Encourage 20 to 30 grams of fiber daily. C. Limit physical activity to conserve energy. D. Use enemas weekly for maintenance. Correct answer: B. Encourage 20 to 30 grams of fiber daily. Rationale: dietary fiber increases stool bulk, stimulates peristalsis, and promotes regular bowel movements. Adequate fluid and physical activity should accompany fiber intake. Enemas are not suitable for routine care due to dependence risk. Strategy: choose sustainable, preventive strategies over temporary fixes. Eliminate interventions that cause dependence, like enemas, or those that contradict basic GI health, e.g., fluid restriction, inactivity. Question 51. A client is admitted for evaluation of melena, black tarry stools. The nurse notes the client has a history of frequent NSAID use. What is the most likely cause of this client's condition? A. Ulcerative colitis. B. Lower gastrointestinal bleeding. C. Esophageal varices. D. Gastric or duodenal ulcer. Correct answer: D. Gastric or duodenal ulcer. Rationale: melena typically results from upper GI bleeding, where blood is digested as it passes through the GI tract. NSAIDs are well known to erode the gastric mucosa, leading to peptic ulcers, which are a common cause of upper GI bleeding. Esophageal varices can also cause upper GI bleeding, but in this client, NSAID use is the likely etiology. Strategy: match clinical symptoms with patient history. Melena equals upper GI bleed. NSAID use equals ulcer risk. Eliminate unrelated conditions, or those less likely given the history. Question 52. The nurse is caring for a client newly diagnosed with celiac disease. Which of the following meals is appropriate? A. Whole wheat toast with butter, eggs, and milk. B. Scrambled eggs, fresh fruit, and gluten-free toast. C. Pasta with marinara sauce and a side of garlic bread. D. Cereal with malt flavoring and skim milk. Correct answer: B. Scrambled eggs, fresh fruit, and gluten-free toast. Rationale: celiac disease is an autoimmune reaction to gluten, a protein found in wheat, barley, and rye. Meal B contains no gluten sources, making it safe. Meals A, C, and D contain gluten-containing ingredients, such as wheat, pasta, and malt. Strategy: know your high-yield dietary restrictions. Look for gluten-containing ingredients and choose the cleanest, safest option. Avoid hidden sources like malt flavoring or wheat-based bread. Question 53. A nurse is caring for a client with hepatic cirrhosis and notices yellow sclerae, confusion, and lethargy. Which action should the nurse take first? A. Notify the healthcare provider. B. Assess the client's ammonia level. C. Prepare for endotracheal intubation. D. Elevate the head of the bed. Correct answer. B. Assess the client's ammonia level. Rationale. These are classic signs of hepatic encephalopathy, which is caused by elevated serum ammonia levels due to impaired liver detoxification. The nurse should first validate the suspicion with lab data. Yellow sclerae also indicate hyperbilirubinemia, but neurological symptoms point to ammonia toxicity. Strategy. Always verify and assess before acting. Question 54. A client with diverticulitis is admitted with abdominal pain, fever, and elevated WBC. What diet is most appropriate during the acute phase? A. High-fiber, low-fat diet. B. Clear liquid diet. C. Low-sodium diabetic diet. D. Regular diet with added fiber. Correct answer. B. Clear liquid diet. Rationale. During acute diverticulitis, the goal is bowel rest. A clear liquid diet reduces fecal bulk and irritation to inflame diverticula. Once symptoms subside, the client may gradually progress to a low residue, then high-fiber diet for long-term prevention. Strategy. Recognize phase-specific treatment. Acute equals rest the bowel. Chronic equals fiber intake. Avoid fiber in acute flare-ups. Question 55. The nurse is preparing to administer an antiemetic to a client undergoing chemotherapy. Which nursing intervention best reduces the risk of anticipatory nausea? A. Administer the antiemetic after chemotherapy begins. B. Delay food intake for 12 hours after treatment. C. Administer the antiemetic 30 to 60 minutes before chemotherapy. D. Avoid giving fluids during chemotherapy. Correct answer. C. Administer the antiemetic 30 to 60 minutes before chemotherapy. Rationale. Anticipatory nausea is a conditioned response that occurs when a client expects chemotherapy to cause nausea. Administering antiemetics prophylactically before the emetogenic stimulus is most effective in reducing this reflex. Waiting until symptoms begin is often too late. Strategy. Timing matters in symptom prevention. For known adverse effects like nausea from chemo, focus on prevention, not reaction. Administer preemptively. Question 56. A nurse is reviewing dietary education for a client with liver cirrhosis and ascites. Which dietary modification is most appropriate to help manage the client's condition? A. Low-protein, low-potassium diet. B. High-protein, high-sodium diet. C. Low-sodium, moderate-protein diet. D. High-carbohydrate, high-sodium diet. Correct answer. C. Low-sodium, moderate-protein diet. Rationale. Sodium restriction is essential to reduce fluid retention and ascites, which is a hallmark of advanced liver disease. Moderate protein is needed to prevent muscle wasting, but avoid excessive protein intake that could worsen hepatic encephalopathy. High sodium would aggravate ascites, and excessive protein could increase ammonia levels. Strategy. Think symptom management through nutrition. Ask yourself, what makes ascites worse? Sodium does. What prevents muscle wasting without worsening encephalopathy? Moderated protein. Avoid all extremes. Question 57. A nurse is evaluating a client who underwent colostomy surgery 2 days ago. Which assessment finding requires immediate notification of the healthcare provider? A. Stoma appears beefy, red, and moist. B. Mucus output from the stoma. C. Stoma appears dusky or purplish. D. Client reports mild gas and bloating. Correct answer C. Stoma appears dusky or purplish. Rationale. A dusky, purplish, or black stoma indicates compromised blood flow and potential ischemia or necrosis. This is an emergency requiring immediate provider notification. A healthy stoma should be red and moist. Mild gas and mucus are expected early post-op findings. Strategy: always identify compromised tissue perfusion. Color changes in a stoma equals circulation issue, equals emergency. Eliminate normal post-op findings like gas or mucus. Question 58. A client with gastroesophageal reflux disease, GERD, reports waking up at night with coughing and a sour taste in the mouth. Which nursing intervention is most effective to reduce these symptoms? A. Recommend a bedtime snack. B. Advise the client to sleep flat on the back. C. Elevate the head of the bed 6 to 12 inches. D. Suggest peppermint tea before bed. Correct answer C. Elevate the head of the bed 6 to 12 inches. Rationale: nocturnal GERD is caused by acid reflux while lying flat, which allows acid to backflow into the esophagus and throat. Elevating the head of the bed reduces this reflux. Peppermint relaxes the lower esophageal sphincter and worsens symptoms. Bedtime snacking and lying flat also aggravate reflux. Strategy: select the option that addresses mechanical positioning to prevent acid movement. Avoid triggers, peppermint, snacking, and focus on gravity's role in reflux prevention. Question 59. A nurse is assessing a client with acute pancreatitis. Which laboratory result supports the diagnosis? A. Decreased serum calcium. B. Increased serum amylase. C. Increased serum potassium. D. Decreased liver enzymes. Correct answer B. Increased serum amylase. Rationale: amylase and lipase are digestive enzymes secreted by the pancreas. In pancreatitis, damaged pancreatic cells release these enzymes into circulation, leading to elevated serum levels. Amylase rises quickly and supports diagnosis. Hypocalcemia may occur, but is not diagnostic. Elevated potassium and liver enzymes may occur in other conditions. Strategy: focus on the most direct marker of pancreatic injury. Know which lab is most sensitive and specific for the affected organ. Amylase equals pancreas. Question 60. A nurse is caring for a client with a small bowel obstruction. Which finding is most expected during physical assessment? A. Hypoactive bowel sounds in all quadrants. B. High-pitched tinkling bowel sounds above the obstruction. C. Absent bowel sounds throughout the abdomen. D. Gurgling sounds in the lower right quadrant only. Correct answer B. High-pitched tinkling bowel sounds above the obstruction. Rationale: a hallmark sign of early small bowel obstruction is hyperactive, high-pitched bowel sounds proximal to the obstruction due to trapped air and fluid. Eventually, bowel sounds may diminish or become absent, but hyperactivity is an early clue. Hypoactive or absent sounds are more typical of late obstruction or paralytic ileus. Strategy: apply knowledge of GI physiology. When peristalsis meets resistance, i.e. obstruction, it initially increases, creating loud, high-pitched sounds. Remember, early, hyperactive; late, hypoactive or silent. Question 61. A client with esophageal cancer is receiving total parenteral nutrition, TPN, via a central line. Which nursing action is most appropriate to reduce the risk of infection? A. Change the central line dressing weekly. B. Use clean gloves when handling the TPN bag. C. Monitor blood glucose every 8 hours. D. Maintain strict aseptic technique during dressing changes. Correct answer D. Maintain strict aseptic technique during dressing changes. Rationale: central lines are a major source of bloodstream infections in hospitalized clients. Strict aseptic technique, including sterile gloves, masks, chlorhexidine cleaning, and sterile dressings, reduces the risk of central line-associated bloodstream infections, CLABSIs. Glucose monitoring is also important, but relates more to metabolic balance than infection prevention. Strategy: always prioritize infection control with central lines. Aseptic technique is a strong keyword. Eliminate non-sterile, infrequent, or passive interventions. Question 62. A client is admitted with Clostridioides difficile, C. diff infection. Which nursing precaution is most appropriate to prevent the spread of infection? A. Airborne precautions with N95 mask. B. Droplet precautions with surgical mask. C. Contact precautions with hand hygiene using alcohol gel. D. Contact precautions with soap and water hand washing. Correct answer: D. Contact precautions with soap and water hand washing. Rationale: C. diff spores are not destroyed by alcohol-based sanitizers, therefore soap and water hand hygiene is required. In addition, contact precautions, gown, gloves, must be implemented. Proper hand washing prevents transmission to other clients and staff. Strategy: no organism-specific precautions. C. diff equals contact precautions plus soap and water. Be alert to exceptions to alcohol hand rub, C. diff, norovirus. Question 63. A client with acute hepatitis A reports fatigue and nausea. The nurse notes mild jaundice and dark-colored urine. Which dietary recommendation is most appropriate for this client? A. High-protein, high-fat diet. B. Low-protein, low-carb diet. C. Small, frequent meals with high carbohydrates. D. Liquid diet only until jaundice resolves. Correct answer: C. Small, frequent meals with high carbohydrates. Rationale: in hepatitis, the liver's ability to metabolize proteins and fats is compromised. Carbohydrates are best tolerated and provide energy. Small meals reduce nausea and support better intake. High-fat or high-protein meals may stress the liver and worsen symptoms. Strategy: select the option that is gentle on the liver and addresses the symptoms: nausea, anorexia, fatigue. Question 64. A client with gastric bleeding is receiving IV pantoprazole. What is the expected therapeutic effect of this medication in this clinical situation? A. Promote vasodilation to reduce pressure in the stomach. B. Increase mucosal secretion to coat ulcers. C. Reduce gastric acid secretion to prevent further irritation. D. Neutralize stomach acid to raise pH above 7.0. Correct answer: C. Reduce gastric acid secretion to prevent further irritation. Rationale: pantoprazole is a proton pump inhibitor, PPI, that suppresses gastric acid production, stabilizing the environment and allowing ulcers or erosions to clot and heal. It doesn't coat the stomach like sucralfate, nor does it neutralize acid, like antacids. Strategy: match drug class to primary mechanism of action. PPIs equals acid suppression. Eliminate options describing other classes, e.g., antacids or mucosal protectants. Question 65. The nurse is caring for a client with short bowel syndrome after extensive surgical resection. Which nutritional complication is the nurse most concerned about? A. Hyperglycemia due to increased digestion. B. Malabsorption and nutrient deficiencies. C. Obesity due to decreased motility. D. Increased fat stores and weight gain. Correct answer: B. Malabsorption and nutrient deficiencies. Rationale: short bowel syndrome leads to a significant loss of absorptive surface in the intestines, resulting in malabsorption of nutrients, especially vitamins, fats, fluids, and electrolytes. Clients often require TPN or specialized diets. Obesity and overabsorption are not common complications here. Strategy: understand the physiology of digestion and absorption. Removal of bowel equals loss of nutrient absorption equals deficiency. Choose the answer that reflects what's missing, not what's in excess. Question 66. A client recovering from a total gastrectomy for stomach cancer begins to experience dizziness, palpitations, and abdominal cramping 15 minutes after eating. What condition is the client most likely experiencing? A. Rebound hypoglycemia. B. Dumping syndrome. C. Gastritis. D. Small bowel obstruction. Correct answer: B. Dumping syndrome. Rationale: dumping syndrome occurs when food enters the small intestine too quickly, especially high sugar or high volume meals after gastrectomy or gastric bypass. Symptoms include dizziness, palpitations, cramping, diarrhea, and sometimes syncope. This is due to a sudden shift of fluid into the bowel, causing hypotension and rapid GI motility. Strategy: identify post-surgical complications related to gastric procedures, recognize the timing of symptoms immediately after eating, and link them to specific GI syndromes like dumping syndrome. Question 67. A nurse is providing dietary teaching to a client with a new ileostomy. Which instruction should the nurse prioritize? A. Increase fluid intake to prevent dehydration. B. Avoid eating high carbohydrate meals. C. Limit protein to reduce odor. D. Consume large meals once a day. Correct answer: A. Increase fluid intake to prevent dehydration. Rationale: clients with ileostomies have no colon, so they lose fluid and electrolytes rapidly through the stoma output. This puts them at high risk for dehydration and electrolyte imbalances. Fluid intake should be increased and monitored daily. Large meals and carb restriction are not necessary unless otherwise directed. Strategy: choose answers that address the most common and dangerous complication of the condition. With ileostomy, it's fluid loss. Always think, what's the biggest threat? Question 68. A nurse is caring for a client with advanced cirrhosis and notices the client's hand flapping involuntarily when arms are extended. What is this finding called? A. Myoclonus. B. Tremor. C. Asterixis. D. Fasciculation.
Correct answer: C. Asterixis. Rationale: asterixis is a flapping tremor of the hands and is a classic physical sign of hepatic encephalopathy. It indicates that the liver is failing to clear ammonia and toxins from the blood, affecting the brain. It often coexists with confusion, lethargy, or personality changes.
Strategy: no classic clinical signs tied to major pathologies. Asterixis equals liver failure, encephalopathy. Don't confuse it with seizure-like or muscle jump activity. Question 69. A nurse is monitoring a client for signs of peritonitis after a ruptured appendix. Which assessment finding requires immediate action? A. Soft abdomen with normal bowel sounds. B. Decreased white blood cell count. C. Abdominal rigidity with rebound tenderness. D. Intermittent abdominal cramping and gas.
Correct answer: C. Abdominal rigidity with rebound tenderness. Rationale:
These are classic signs of peritoneal inflammation or peritonitis, a life-threatening emergency that may follow organ rupture, e.g., appendix, bowel, ulcer. The peritoneal lining becomes infected and sepsis can quickly develop. The abdomen may become rigid, painful, and silent. Strategy: always treat abdominal rigidity plus rebound pain as a red flag. In post-rupture situations, peritonitis is the top concern and must be acted upon immediately. Question 70. A client has been taking aluminum hydroxide, an antacid, regularly for heartburn. Which lab value should the nurse monitor most closely? A. Serum potassium. B. Serum magnesium. C. Serum calcium. D. Serum phosphate. Correct answer: D. Serum phosphate. Rationale: aluminum-containing antacids bind with phosphate in the gut, reducing phosphate absorption and leading to hypophosphatemia, especially with long-term use. Symptoms can include muscle weakness, fatigue, and even respiratory depression in severe cases. Monitoring phosphate levels is crucial.
Hey, if you're still watching, I just want to take a quick moment to say, you are doing an amazing job. Learning isn't always easy, especially when it comes to topics as intense as this. But the fact that you're here, putting in the time and effort already sets you apart from the rest. Don't let self-doubt slow you down. Remember, every second you invest in yourself is a step closer to your goals.
Question 71. A nurse is caring for a client with gastrointestinal bleeding due to a bleeding duodenal ulcer. The client suddenly becomes pale, diaphoretic, and hypotensive. What is the nurse's priority action? A. Increase the IV fluid rate as prescribed. B. Check for fecal occult blood. C. Place the client in high Fowler's position. D. Obtain a blood glucose reading. Correct answer: A. Increase the IV fluid rate as prescribed. Rationale: the client is showing signs of hypovolemic shock, pallor, diaphoresis, and hypotension. These symptoms suggest acute volume loss from GI bleeding. Restoring intravascular volume is the first priority to maintain perfusion to vital organs. While diagnostic measures like fecal occult testing are useful, they do not take precedence over life-saving stabilization. Strategy: apply the ABC principle with emphasis on circulation here. Look for the answer that addresses physiological instability immediately, not just assessment or diagnostic steps. Always stabilize before investigating. Question 72. A client with acute pancreatitis reports worsening pain after eating and lying flat. Which nursing intervention is most appropriate to help relieve the client's pain? A. Provide a high-protein, high-fat diet. B. Place the client in a supine position. C. Keep the client NPO and administer IV fluids. D. Encourage deep breathing exercises hourly. Correct answer: C. Keep the client NPO and administer IV fluids. Rationale: in acute pancreatitis, food intake stimulates the pancreas, which worsens inflammation and pain. NPO status with IV hydration is the mainstay of early treatment. Pain is also worsened in the supine position because it stretches the inflamed peritoneum. Resting the pancreas allows healing and reduces enzyme secretion. Strategy: link symptoms, pain after eating and lying down, with the physiology of the condition. Choose the answer that removes the stimulus, here, food, and supports the body through hydration and rest. Question 73. A client is admitted with a suspected large bowel obstruction. Which of the following findings would most strongly support this diagnosis? A. Explosive watery diarrhea. B. Visible peristaltic waves and hyperresonant abdomen. C. Gradual onset of crampy lower abdominal pain and distension. D. Pain relieved by defecation or passing flatus. Correct answer: C. Gradual onset of crampy lower abdominal pain and distension. Rationale: large bowel obstructions typically present with gradual onset of colicky pain, progressive distension, and constipation or inability to pass gas. Vomiting occurs later and is less frequent than with small bowel obstruction. Hyperresonance and visible peristalsis are more common in small bowel obstruction. Strategy: distinguish between small versus large bowel obstruction. Focus on the location of pain, onset, and characteristics of distension and gas. Use clinical logic. Large intestine equals slower progression. Question 74. The nurse is caring for a client post-op day 2 following abdominal surgery. The client has no bowel sounds and reports nausea and abdominal fullness. What should the nurse suspect? A. Constipation. B. Normal postoperative findings. C. Paralytic ileus. D. Small bowel obstruction. Correct answer: C. Paralytic ileus. Rationale: paralytic ileus is a temporary cessation of bowel motility, often seen after abdominal surgery, particularly when handling of intestines occurs. Symptoms include absent bowel sounds, nausea, vomiting, and abdominal distension. While some delay in GI function is expected post-op, complete absence of sounds and fullness beyond 48 hours suggests ileus rather than normal recovery. Strategy: watch for absence of bowel activity, distension, nausea post-abdominal surgery. Don't dismiss abnormal findings as normal too quickly. Question 76. A client is admitted with acute hepatitis B. Which precautionary measure should the nurse implement to prevent the spread of the virus? A. Initiate airborne precautions. B. Use gloves when handling the client's blood or body fluids. C. Avoid assigning a roommate to prevent droplet transmission. D. Place the client on contact isolation. Correct answer: B. Use gloves when handling the client's blood or body fluids. Rationale: Hepatitis B is transmitted via blood and body fluids, including sexual contact, contaminated needles, and from mother to child. It is not spread through the air or casual contact, so airborne, droplet, or contact isolation is not needed unless there's active bleeding or open wounds. Standard precautions with appropriate PPE, especially gloves, are sufficient to prevent transmission. Strategy: use your knowledge of disease transmission routes. Eliminate airborne and droplet options unless the condition is respiratory-based. Choose standard precautions for blood-borne viruses. Question 77. A nurse is educating a client newly diagnosed with lactose intolerance. Which statement by the client indicates a correct understanding of the condition? A. I can drink milk as long as it's whole milk. B. I should completely eliminate all carbohydrates. C. I can eat hard cheeses and yogurt in small amounts. D. I will avoid all fruits and vegetables. Correct answer: C. I can eat hard cheeses and yogurt in small amounts. Rationale: clients with lactose intolerance lack sufficient lactase enzyme to digest lactose found in milk products. However, hard cheeses and yogurt contain lower levels of lactose and are often tolerated in moderation. Whole milk still contains lactose, and carbohydrates or fruits and vegetables do not need to be eliminated unless the client has additional dietary restrictions. Strategy: look for the option that offers balanced and practical management, not extreme restrictions. Identify which foods have lower lactose content and are thus more tolerable. Question 78. A client is experiencing nausea and vomiting. The healthcare provider orders ondansetron Zofran IV every 8 hours as needed. Before administering the medication, which assessment is most critical? A. Bowel sounds in all quadrants. B. Blood pressure and heart rate. C. History of QT prolongation or arrhythmias. D. White blood cell count. C. History of QT prolongation or arrhythmias. Rationale: ondansetron can prolong the QT interval, increasing the risk of life-threatening ventricular arrhythmias like torsade de pointe, especially in clients with a cardiac history or those on other QT prolonging drugs. While nausea, vomiting, and bowel sounds matter, cardiac monitoring is the most critical safety concern with ondansetron. Strategy: understand medication-specific risks. When a drug is associated with cardiac conduction issues, check for cardiac history or EKG changes before administration. Prioritize life-threatening complications. A nurse is reviewing post-procedure care for a client who just returned from a liver biopsy. Which action is most appropriate? A. Place the client in high Fowler's position. B. Keep the client NPO for 12 hours. C. Position the client on the right side. D. Monitor for hematuria. C. Position the client on the right side. Rationale: after a liver biopsy, the client should be positioned on the right side to apply pressure on the biopsy site and reduce the risk of bleeding from the highly vascular liver. Fowler's position is not advised because it doesn't apply pressure to the site, NPO is unnecessary unless the client is going for another procedure. And hematuria is not expected unless there's kidney involvement. Strategy. Post-procedure positioning often prevents complications. For liver biopsy, think right side equals pressure on liver. Choose the positioning that supports hemostasis. Question 80. A client with peptic ulcer disease, PUD, is prescribed sucralfate. What should the nurse include when teaching about this medication? A. Take this medication after meals and at bedtime. B. It works by neutralizing stomach acid. C. Avoid taking it with antacids or other medications within 30 minutes. D. This medication is used to relieve constipation caused by ulcers. Correct answer, C. Avoid taking it with antacids or other medications within 30 minutes. Rationale. Sucralfate is a mucosal protectant that adheres to ulcer craters and protects them from acid and pepsin. It should be taken on an empty stomach, usually 1 hour before meals and at bedtime. Taking antacids or other medications too soon, before or after sucralfate, interferes with its binding to the ulcer surface. Strategy. Focus on timing and drug interactions. Sucralfate is not an acid reducer. It forms a physical barrier. The key teaching point is about spacing with other meds for full effect. You've got it. Let's keep the momentum strong with the next set. NCLEX Questions 81 through 85 on gastrointestinal disorders. Fully enriched with deep rationales and highly strategic test-taking guidance to strengthen both knowledge and critical thinking. Question 81. A client is diagnosed with ulcerative colitis and is experiencing frequent bloody diarrhea, abdominal cramping, and urgency to defecate. Which nursing diagnosis is most appropriate during this acute phase? A. Risk for constipation. B. Imbalanced nutrition, more than body requirements. C. Fluid volume deficit. D. Ineffective airway clearance. Correct answer, C. Fluid volume deficit. Rationale. Ulcerative colitis causes frequent bloody liquid stools, leading to fluid and electrolyte loss, dehydration, and sometimes hypovolemia. Managing fluid balance is a priority during acute flares. Risk for constipation is incorrect because the client has diarrhea, not reduced motility. Ineffective airway clearance is unrelated to the condition. Strategy. Prioritize based on actual versus potential problems. Look for what is happening now, not what might happen later. Identify the problem most threatening to physiological stability, in this case, fluid loss. Question 82. A nurse is assessing a client with chronic liver disease and notes the presence of spider angiomas, palmar erythema, and gynecomastia. What is the most likely underlying cause of these findings? A. Hyperaldosteronism. B. Portal hypertension. C. Hormonal imbalances due to liver dysfunction. D. Malnutrition. Correct answer, C. Hormonal imbalances due to liver dysfunction. Rationale. In chronic liver disease, the liver loses its ability to metabolize hormones, including estrogen. This leads to elevated circulating estrogen, which manifests as spider angiomas, dilated blood vessels, palmar erythema, and gynecomastia, breast tissue development in men. Portal hypertension causes different findings, e.g. varices, ascites. Strategy. Connect visible signs with pathophysiology. When multiple symptoms suggest hormonal effects, think endocrine dysfunction, not mechanical problems like pressure, portal hypertension, or volume issues, aldosterone. Question 83. The nurse is teaching a client with celiac disease about dietary changes. Which client statement indicates a need for further education? A. I will need to read food labels carefully. B. I can still enjoy corn and rice products. C. I will avoid wheat, rye, and barley. D. Once I feel better, I can reintroduce small amounts of gluten. Correct answer, D. Once I feel better, I can reintroduce small amounts of gluten. Rationale. Celiac disease is a lifelong autoimmune disorder, and even small amounts of gluten can trigger inflammation and intestinal damage. There is no safe threshold for gluten reintroduction. The other statements correctly reflect gluten avoidance and safe food substitutions. Strategy. In teaching questions, look for dangerous misunderstandings or assumptions. If the client suggests doing something against lifelong disease management, it's a red flag. Question 84. A nurse is preparing a client with gastroesophageal reflux disease, GERD, for discharge. Which statement by the client indicates a correct understanding of self-care strategies? A. I'll drink peppermint tea after meals to help with digestion. B. I will lie flat for 30 minutes after eating to avoid heartburn. C. I should eat smaller meals and avoid eating late at night. D. I will wear tight clothing around my abdomen to support my posture. Correct answer. C. I should eat smaller meals and avoid eating late at night. Rationale. Eating small, frequent meals helps prevent gastric overdistension, and avoiding food 2 to 3 hours before bed reduces nighttime reflux. Peppermint relaxes the lower esophageal sphincter, LES, and worsens reflux. Lying flat and wearing tight clothing also increase intra-abdominal pressure, worsening symptoms. Strategy. Identify effective lifestyle modifications. Eliminate answers that exacerbate LES relaxation or increase abdominal pressure, both common GERD triggers. Question 85. A nurse is caring for a client with Crohn's disease who has developed fistulas and malabsorption. Which nutritional intervention is most appropriate? A. High fiber, high residue diet. B. Low protein, low fat diet. C. High protein, high calorie diet. D. Clear liquid diet with no supplements. Correct answer. C. High protein, high calorie diet. Rationale. Clients with Crohn's disease, especially those with fistulas, inflammation, and malabsorption, require increased protein for healing and high-calorie intake to meet nutritional needs. Fat may be restricted only if the client is intolerant. Fiber is minimized during flare-ups or fistula formation to reduce irritation. Strategy. Link nutritional needs to disease complications. With inflammation and tissue breakdown, the body demands protein for healing and calories to combat weight loss. Avoid high-fiber or low-nutrition diets unless the scenario specifies otherwise. Question 86. A client presents to the emergency department with severe epigastric pain radiating to the back, nausea, and vomiting. Serum amylase and lipase levels are markedly elevated. Which nursing intervention is the highest priority? A. Initiate NPO status and start IV fluids. B. Administer a high-protein liquid diet. C. Provide a heating pad for abdominal pain. D. Insert a urinary catheter to monitor output. Correct answer. A. Initiate NPO status and start IV fluids. Rationale. The client shows classic signs of acute pancreatitis, including epigastric pain radiating to the back, elevated amylase or lipase, and nausea or vomiting. The pancreas must rest, no food or liquids, because food stimulates enzyme secretion, which can worsen inflammation. IV fluids are essential to prevent hypovolemia caused by third spacing of fluids. Catheterization may follow, but is not the first intervention. Heating pads can increase vasodilation and worsen inflammation. Strategy. Focus on organ rest and physiological stabilization. In pancreatitis, your first step is always to stop the stimulus, NPO, and replace fluid losses. Eliminate non-priority comfort or secondary monitoring interventions. Question 87. A client with gallstones, cholelithiasis, is scheduled for a laparoscopic cholecystectomy. Which statement made by the client indicates the need for further teaching? A. I might have shoulder pain from gas used during the procedure. B. I will need to avoid fatty foods for a few weeks after surgery. C. This surgery requires a large abdominal incision and longer recovery. D. I'll need to walk around soon after surgery to help pass the gas. Correct answer. C. This surgery requires a large abdominal incision and longer recovery. Rationale. A laparoscopic cholecystectomy involves small incisions, minimal muscle disruption, and a short recovery time. It is a minimally invasive surgery, not an open procedure. Shoulder pain is common due to CO2 gas used for insufflation. Early ambulation helps gas reabsorption and prevents complications. Fatty foods should be avoided post-op as bile storage is altered. Strategy. Identify misconceptions about procedures. Look for answers that reflect outdated or incorrect assumptions, like large incisions in laparoscopy. Validate understanding by cross-checking procedure characteristics. Question 88. A nurse is caring for a client with hepatic encephalopathy, receiving lactulose. Which finding indicates that the treatment is effective? A. 2 to 3 soft bowel movements daily. B. Decreased serum bilirubin levels. C. Increased serum ammonia levels. D. Resolution of jaundice. Correct answer. A. 2 to 3 soft bowel movements daily. Rationale. The therapeutic goal of lactulose in hepatic encephalopathy is to reduce serum ammonia by promoting its excretion through the stool. The desired outcome is 2 to 3 soft stools per day, which indicates effective toxin clearance. Decreasing bilirubin and jaundice are liver function indicators, not specific to encephalopathy. Increased ammonia would suggest worsening. Strategy. Match the drug's purpose with clinical outcome. For lactulose, think ammonia. Poop. Choose the result that shows the body is excreting toxins effectively. Question 89. A client with a history of peptic ulcer disease suddenly complains of severe abdominal pain, has a rigid abdomen, and shallow respirations. What should the nurse do first? A. Administer prescribed antacids. B. Notify the healthcare provider immediately. C. Offer sips of water for comfort. D. Apply a heating pad to the abdomen. Correct answer. B. Notify the healthcare provider immediately. Rationale. These symptoms are classic for perforation, a surgical emergency in peptic ulcer disease. A rigid abdomen and sudden pain suggest that gastric contents have spilled into the peritoneal cavity, causing peritonitis. This situation requires immediate surgical evaluation. Administering anything orally or applying heat can worsen the condition. Strategy. Look for signs of life-threatening GI emergencies. Example, rigidity plus pain equals perforation. Prioritize emergency notification and stabilization over symptomatic treatments. Question 90. A nurse is caring for a client who is post-esophago-gastroduodenoscopy, EGD. Which assessment finding requires immediate intervention? A. Complaints of a sore throat. B. Drowsiness and mild nausea. C. Mild bloating and belching. D. Reports of abdominal pain and shoulder pain. Correct answer. D. Reports of abdominal pain and shoulder pain. Rationale. Post-EGD shoulder and abdominal pain may indicate perforation, especially if accompanied by abdominal tenderness or distension. This is a serious complication, requiring urgent evaluation. A sore throat, nausea, and bloating are expected due to scope insertion and air insufflation. Strategy. In post-procedure questions, identify unexpected and alarming signs. Mild discomfort is normal, but pain plus systemic symptoms equals red flag. Don't downplay pain that localizes or radiates, especially shoulder, which could indicate diaphragm peritoneum irritation. Question 91. A client with esophageal varices begins to vomit bright red blood. The nurse immediately checks vital signs and notes a blood pressure of 86/50 and heart rate of 124/BPM. What is the priority intervention? A. Place the client in Trendelenburg position. B. Prepare for endoscopy and blood typing. C. Administer oral proton pump inhibitor. D. Insert a nasogastric tube for decompression. Correct answer. B. Prepare for endoscopy and blood typing. Rationale. This client is experiencing active upper GI bleeding with signs of hypovolemic shock. Esophageal varices are fragile, dilated veins prone to rupture in clients with portal hypertension. The priority is to stabilize the client and prepare for endoscopic intervention, e.g. band ligation or sclerotherapy, and type and cross for potential transfusion. Inserting an NG tube is contraindicated due to risk of further rupture. Trendelenburg is not recommended for hypotension due to bleeding. It can worsen intracranial pressure and doesn't improve outcomes. Oral meds are contraindicated when the patient is vomiting blood. Strategy. Prioritize life-saving interventions in clients with GI bleeding. Secure the airway, restore volume, and prepare for definitive intervention, endoscopy. Eliminate options that involve oral intake or procedures that could worsen bleeding. Question 92. A client is scheduled for a sigmoidoscopy. Which instruction should the nurse include in pre-procedure teaching? A. You will need to fast for 24 hours before the test. B. You'll be sedated during the procedure. C. You'll be awake and may feel mild pressure or cramping. D. You will need general anesthesia and a recovery room stay. Correct answer. C. You'll be awake and may feel mild pressure or cramping. Rationale. A sigmoidoscopy is a diagnostic procedure that examines the rectum and lower colon. Unlike colonoscopy, sedation is usually not required. Clients are often awake and alert, and may experience mild discomfort, pressure, or cramping. Light dietary restrictions and bowel prep, enema laxative, may be ordered, but general anesthesia and extensive fasting are unnecessary. Strategy. Distinguish between levels of invasiveness and anesthesia. Colonoscopy equals sedation. Sigmoidoscopy equals minimal or no sedation. Choose options that reflect accurate procedural expectations. Question 93. A nurse is reviewing labs for a client with acute liver failure. Which lab result is most critical to report immediately? A. Elevated ALT and AST. B. INR of 3.5 without anticoagulation therapy. C. Low serum albumin. D. Total bilirubin of 2.5 milligrams per deciliter. Correct answer. B. INR of 3.5 without anticoagulation therapy. Rationale. An elevated INR in the absence of anticoagulants indicates a decline in hepatic synthetic function, especially the production of clotting factors. In liver failure, the inability to produce these proteins can lead to life-threatening bleeding. Elevated liver enzymes, ALT/AST, reflect injury but are not as acutely dangerous. Low albumin and elevated bilirubin reflect chronic changes, but are not emergent. Strategy. Choose the lab value that suggests immediate risk. Think in terms of coagulation and bleeding. INR great -3 without warfarin or other therapy equals a red flag in liver clients. Question 94. The nurse is teaching a client with diverticulosis about preventing complications. Which client statement indicates correct understanding? A. I will increase my fiber intake gradually. B. I will take a laxative every day to keep things moving. C. I need to avoid all nuts, seeds, and corn permanently. D. I should limit fluid intake to reduce bloating. Correct answer? A. I will increase my fiber intake gradually. Rationale. Diverticulosis is managed with dietary fiber, which promotes regular bowel movements and reduces pressure in the colon. Increasing fiber too quickly may cause gas and discomfort, so gradual introduction is key. The advice to avoid nuts/seeds is outdated. Recent evidence shows they do not increase risk of diverticulitis. Daily laxative use can lead to dependency and worsen bowel tone. Fluid should be increased with fiber to avoid constipation. Strategy. Choose the evidence-based approach that focuses on prevention, not myths. Eliminate outdated teachings and emphasize safe, sustainable practices. Question 95. A client receiving parenteral nutrition, PN, via a central line develops shortness of breath, chest pain, and air hunger during tubing change. What is the nurse's immediate action? A. Notify the healthcare provider. B. Place the client on a cardiac monitor. C. Turn the client on the left side and lower the head of the bed. D. Elevate the head of the bed and apply oxygen. Correct answer? C. Turn the client on the left side and lower the head of the bed. Rationale. These symptoms suggest a suspected air embolism, a potential complication of central line care. The correct emergency position is left lateral, Trendelenburg, which traps air in the right atrium and prevents it from entering the pulmonary circulation. This maneuver buys time for the air to be absorbed. Oxygen can be administered afterward. Calling the provider is important, but not the immediate life-saving action. Strategy. Prioritize based on ABC and nursing actions that stop progression of an emergency. In embolism situations, remember left side, lower head to trap air. Choose immediate, life-saving positioning over documentation or secondary monitoring. Question 96. A client with Crohn's disease is being discharged on infliximab, a tumor necrosis factor (TNF) inhibitor. Which client statement indicates a need for further teaching? A. I will report any fever or cough to my provider. B. I will avoid receiving live vaccines during therapy. C. This medication strengthens my immune system to fight infection. D. I will need regular blood tests while on this medication. Correct answer, C. This medication strengthens my immune system to fight infection. Rationale. Infliximab is an immunosuppressive biologic agent used to reduce inflammation in autoimmune diseases like Crohn's. It lowers immune defenses, increasing the risk of infections such as TB, Hepatitis B, and fungal infections. Clients must avoid live vaccines and promptly report signs of infection. Routine monitoring, e.g. liver function, CBC, is essential to detect adverse effects. Strategy. Identify false beliefs about the mechanism of action. If a statement reflects the opposite of how a drug works, like strengthening the immune system when it actually weakens it, that's your red flag. Question 97. A client with acute appendicitis is awaiting surgery. Which intervention should the nurse avoid? A. Keeping the client NPO. B. Administering prescribed IV fluids. C. Applying a heating pad to the abdomen. D. Positioning the client in semi-Fowler's position. Correct answer, C. Applying a heating pad to the abdomen. Rationale. Heat increases blood flow, which may accelerate inflammation or perforation of the appendix. It is contraindicated in clients with appendicitis. Cold compresses may be used for pain relief. NPO status, IV fluids, and semi-Fowler's positioning, which localizes the infection in the lower abdomen, are all appropriate. Strategy. In acute abdominal emergencies, avoid any action that might stimulate or spread inflammation, e.g. heat, massage. Choose safety over comfort. Question 98. A client recovering from gastric surgery complains of dizziness, palpitations, and a desire to lie down shortly after eating. What is the most appropriate nursing recommendation? A. Try walking for 15 minutes after each meal. B. Switch to a high carbohydrate diet. C. Lie down for 30 to 60 minutes after meals. D. Drink fluids with your meals to aid digestion. Correct answer? C. Lie down for 30 to 60 minutes after meals. Rationale? These symptoms reflect dumping syndrome, where food rapidly enters the small intestine, causing fluid shifts and hypovolemia. Lying down after meals slows gastric emptying. Other strategies include low-carb, high-protein meals and avoiding fluid intake during meals. Walking and drinking with meals worsen symptoms. Strategy. For dumping syndrome, focus on slowing gastric movement and reducing fluid shifts. Eliminate answers that increase motility or blood glucose spikes, such as walking or high-carb meals. Question 99. A nurse is caring for a client with colorectal cancer who underwent a colostomy. The client says, "I'm afraid my spouse will be disgusted by the stoma." What is the best initial response by the nurse? A. You'll feel better once you're used to the pouching system. B. You shouldn't worry about that. Your spouse will love you anyway. C. Tell me more about what you're feeling. D. It's common for people to feel embarrassed after surgery. Correct answer, C. Tell me more about what you're feeling. Rationale. This is a therapeutic communication question. The best initial response is an open-ended invitation that allows the client to express feelings without judgment or minimization. Statements that offer false reassurance or assumptions do not promote emotional processing or individualized support. Strategy. In communication questions, always choose responses that encourage expression and exploration, not cheerleading or dismissing. Avoid, "You'll be fine," and "Don't worry" types of answers. Question 100. A client with a history of chronic alcohol use is admitted with hematemesis, vomiting blood. The nurse suspects esophageal variceal bleeding. Which medication would the nurse expect to be prescribed to reduce portal hypertension and prevent further bleeding? A. Pantoprazole. B. Propranolol. C. Metoclopramide. D. Sucralfate. Correct answer, B. Propranolol. Rationale. Non-selective beta blockers, like propranolol, are used to reduce portal venous pressure, decreasing the risk of esophageal variceal rupture. While PPIs, example pantoprazole, are used for ulcers, they don't reduce portal pressure. Metoclopramide is for nausea and delayed gastric emptying. Sucralfate coats ulcers but doesn't affect varices. Strategy. Link the drug's mechanism to the pathophysiology. In variceal bleeding, the issue is pressure, not acid, so choose drugs that target vascular tone and pressure, not mucosal coating. If you made it this far, congratulations! You just mastered 80 of the most high-yield GI questions for the NCLEX. You didn't just memorize answers, you learned how to think like a nurse. That final stretch, those critical thinking drills, that's where your NCLEX breakthrough begins. So don't stop here. Hit subscribe, drop a comment, and share this with a friend who's on the same journey. Let's know how many questions you answered correctly by dropping it in the comments section below.